Today's episode is sponsored by Vitality Health RX Supplements. Whether you're an athlete, a busy professional, or just someone looking to prioritize health, Vitality Health RX has what you need. With premium ingredients and rigorous quality control, their supplements support your body's natural functions. Visit shopvrx.com and use code FEELGREAT15 for 15% off your first order. Thanks to Vitality Health RX for sponsoring this episode. Now let's dive in.
Hey there, welcome back to the Feel Better, Feel Great podcast. I'm Dr. Andrea McSwain, and I'm excited to share some incredible news with you today. After a long time of listening to patient requests and community requests, we're officially starting our Feel Better, Feel Great Functional Wellness membership. It's a brand new way to support you on your health journey. If you've ever wanted to take a deep dive into more detail on one of my previous podcast episodes or find resources to help you on your wellness path, this membership is designed just for you. Plus, you'll be joining a community of like-minded people who are just as passionate about health as you are. I'm also thrilled to introduce our live monthly hot seat sessions where you can ask your personal health questions and get my direct insights and education. It's going to be an incredible way for us to connect on a deeper level. And I can't wait for you to join me inside this amazing new community. So let's dive into two critical topics today: cancer prevention and treatment with antioxidants and ozone therapy. This definitely seems paradoxical, and I did that with intention because I think it's really important to share things for clarification. And it's very difficult sometimes to navigate the larger community when you're getting this piece of information and that piece of information. Also, I truly believe that medicine and health education is based in love and not fear. I really want you to understand things as they work for you, of course. And I also want you to understand that medicine is about healing and medicine needs to be based in love. Therefore, when I talk with you, I base it in love. And I really avoid discussing things that are just fear-based because I think fear is really an antithesis to healing. So when I share this, I'm doing it on purpose because a lot of people are talking about antioxidants, and I just talked to you about acute oxidative stress in my last podcast. So I want to say how they actually come together. And then, of course, what am I doing? Picking a very hot topic of cancer prevention and treatment. And why is that? Because 39% of people are going to be given the diagnosis of cancer. And that is awful. If you're in my practice, you know, I want you to never see a hospital. I want you to never see an emergency room. I never want you to see a surgery suite. I never want you to hear words like cancer. And those are also ideas based in love, right? So before you even hear about those things, think about what life could be if you're able to walk on your own, right? Live on your own, be your own person, use your mind, keep building relationships all of your life, and get to be healthy at 100. And I really want to frame that. And then I want to put in this like juxtaposition between antioxidants and then something that is an oxidative stress, like ozone therapy. So I'm going to talk to you about how the therapies work. I'm going to discuss some expert research, address some common concerns that you might have, and then I'm going to walk you through some real life examples where these approaches really made a difference. So we're going to talk about how antioxidants made a difference, how oxidation, acute stress made a difference. In fact, when I was thinking about real life examples, I was like, what am I going to say? Because we use ozone and antioxidants so often in our practice, it's just a regular thing here. But we do have some remarkable stories, and I'll share those with you. So first of all, the role of antioxidants in cancer prevention. There are things called free radicals, and those are ongoing stress. They can stay in the body. So antioxidants neutralize free radicals. I think of free radicals as chronic oxidative stress, which I think of as rusting. So when the cells get damaged and rusted, they've been oxidized. Now this can lead with free radicals to cancer development, which is very important. So free radicals come from exposure to things like pollution, highly processed foods, and even emotional and other stresses and demands on the body and on the mind. So there are antioxidants that come in foods, and they're called phytonutrients. Which phytonutrients, right? Phyto is plants and nutrients. So phytonutrients, plant-based nutrients that are fruits, vegetables. They're often concentrated in supplements that are designed to protect your cells from this damage. There's also antioxidants in injections and IVs. There is undeniable evidence of dietary antioxidants in reducing cancer risk by limiting oxidative damage, which comes from free radicals. And this oxidative damage affects DNA, proteins, lipids. Then you get into affecting tissues and organs and systems. And that oxidative damage is another form of explaining how cancer develops in the body. So when we look at dietary antioxidants, we look at your fruits and vegetables, but also the things that are vitamin C, vitamin E, selenium. So vitamin C is in lots of citrus. It's in a lot more of the lemon peel than the lemon juice, right? Vitamin E, you'll find that in a lot of fruits and vegetables. Selenium in Brazil nuts. Just things to think about. Immediately came to mind avocados, because avocados are amazing. And I don't know why I just thought of that, but I do love avocados. And I was like, oh yeah, I should say that. Because anyway, just thinking about things that pop into your head. Sometimes our body actually tells us what we need to eat in a good way, which is really fun. So I must be craving avocados right now, which is a really good thing. So, okay, some of you may think that the effectiveness of antioxidants in cancer prevention can vary. While some critics argue that antioxidants are beneficial, these critics do not see a direct role in cancer prevention, because you have to think about things with antioxidant dosing, an individual's health, and then existing damage in the body. But I will tell you, plant-based nutrients or plant-based antioxidants are the ounce of prevention that's worth a pound of cure. There are studies showing that consuming antioxidant-rich diets lowers the overall risk of several cancers, especially those related to oxidative stress. So those are lung, breast, prostate cancers. There is good evidence that pomegranate juice, even commercial grade pomegranate juice, when taken in a cup a day, this is a little heavy, so let me start again. So prostate cancer and pomegranate juice go hand in hand, because the antioxidants found in pomegranate juice directly reduce the doubling time of men who had known prostate cancer. It changes it from 18 months to 52 months. That is more than tripling the time of duration from recurrence. That is an impressive argument towards the use of pomegranate to reduce the recurrence rate of prostate cancer, and I would say you even could infer to create prevention for prostate cancer. Now, what do we do with plants? Okay, well, we eat 9 to 11 servings a day. I remember when I first started saying this, it was like, I don't know, 2013. Yeah, I was in my OB-GYN practice, and I was just telling people 9 to 11 servings a day. And if you can get that in, you probably can't get anything else in, quite honestly. That's a lot of fruits and vegetables. That's about a half a cup. You can also find this if you have somewhere available to have a cold pressed juice, or you can immediately drink the juice in a home juicer, because these home juicing is very potent antioxidants, and they're very concentrated antioxidants, so that you can get them in and get to healing. You can also find a really good dose of antioxidants in green powders, but not all green powders are created equal, and it's really good to know your source. So that's very important. We have a Vitality RX Daily Greens, has a significant quantity of phytonutrients, and it's a very reliable, trustworthy product. Again, even if you're thinking about prevention, these are the things you want to incorporate into your life. Just add a little bit of water to the powder, and there you go. Or use cold pressed juice, and it makes a huge difference into prevention, because you're getting a huge dose of antioxidants. And this is really about looking at never hearing those words, right? That's very important. Now, realizing, of course, that as I mentioned, these are all varied on your dosage, your individual health, and if there's already damage in the body from different exposures. However, prevention is very, very important. How does ozone work in cancer treatments or even cancer prevention? So I want to switch gears to ozone therapy. It's an exciting approach that's gaining more attention in integrative cancer treatments. Ozone therapy involves administering medical grade ozone to boost oxygen delivery to tissues, improve immune function, stimulate the body's healing mechanisms, and encourage elimination. So ozone is O3. Normally oxygen is delivered in pairs, but ozone is 3 oxygen molecules together. And when it does that, think about OxyClean and how OxyClean is supportive of the healing, right? Or it's supportive of the cleaning process. When you use an oxygen tank or pure O2 and you run it through an ozone generator, now you have a very pure medical grade ozone. That's important. That you also think about medical grade ozone. There's other ways to get ozone, like if you don't connect it to a tank, you can, support maybe some room purification. But really what we do, we use medical grade ozone. And when you use medical grade ozone, it creates a controlled acute oxidative response that leads to the destruction of cancer cells. That's a big statement. It also enhances antioxidant defenses in healthy cells. And I realize that people might be uncomfortable with this idea that something could actually kill cancer cells. But there are a lot of chemotherapy agents which are designed to kill cancer cells. However, we haven't seen changes in improvements for mortality rates for cancer, period. And then we start thinking about, because there's a lot of destruction and also a lot of chemotherapy agents actually increase oxidative stress, and that's really how they're designed. Now we look at something that changes the oxidative stress to acute oxidation, which is ozone therapy, versus chronic oxidation stress, which is chemotherapy. So ozone therapy is controversial in conventional medicine. Again, it's cheap as all get out. It's very effective. There's actually ways you can do it at home, use it at home. It can be given via IV. So I'm not quite sure why conventional medicine hasn't kind of attached itself to this, other than the fact that, again, it's extremely inexpensive and highly effective. So some conventional oncologists continue to remain skeptical. Some oncologists also don't talk about the benefits of using plants and eating plants and vegetables, fruits and vegetables in your diet. I'm always shocked in conventional medicine still, in oncology suites, that this is like a bakery of grandma's goodies. There's brownies and cakes and cupcakes and cookies and a million sweets and sugars. And we know that sugar is toxic. So why is an oncology suite where people get chemotherapy, is it having a ton of sugar available? Even wafting that into your nose is probably toxic. Just getting those smells in at that quantity. So I remember being in the oncology suite. It was like, this was a while ago because I haven't been in an oncology suite in a long time, but this was like December of 2008. And it was unbelievable. I mean, there was not enough counter space to handle the amount of sweets that were coming in every single day. It was just around Christmas. Everyone was excited and they wanted to thank the staff because there was normally several options for sweets. However, right around Christmas time, like I said, there wasn't even enough counter space to put all these decadent, highly processed sugars in dessert form on the counter. So I'm a little confused why conventional medicine is still very pro-sugar and very anti things like ozone therapy or encouraging people to eat plants as a mainstay, or encouraging juicing, all of which have tremendous benefits on our health, however, are often ignored because they're too easy. I think that's really it. Like, that's what I have in my practice. Like, sometimes people think, well, all this stuff you do is like, it's really easy. Well, actually, it's very difficult. There's tons of complex science behind it. But we make it easy. It's very simple for you to do, and it's very effective. So sometimes simple and effective can go hand in hand. I think that's the case with ozone therapy. It can help reduce many things that are related to cancer metrics. So it looked to tumor size, quality of life, and also looking at how to mitigate side effects of traditional cancer treatments from chemotherapy and radiation. That's very big. There's a lot of side effects from radiation that go undiscussed until someone has those side effects. And there's so many ozone products that we use and ozone techniques. Also, we use a lot of KPS products. I'm just going to put that in there. I probably could just talk about the antioxidant products available in KPS Essentials because it's profound. And that is an important discussion, but I'll do that a little bit later, I guess. So, research supporting ozone therapy in cancer care. It did find in 2019, there was a study that found that ozone therapy could enhance the effects of chemotherapy by improving oxygenation in hypoxic tumor environments, which makes cancer cells more vulnerable to treatment. So one of the things that's a little ironic in cancer is they build a lot of, the cancer cells will create a lot of like abnormal vessel. It's called angiogenesis. So the blood vessels will grow kind of crazy, but you get kind of this nesting effect in a tumor. And so it starts to like really protect itself, and a hypoxic means low oxygen. So these tumors can get have quite a bit of growth in a low oxygen state, and ozone coming in is creating an oxidative stress for the tumor that's very acute, but the tumor will then start to get this oxygenation, and that will help the body actually recognize and attack the tumor cells. The other issue there is a lot of times tumor size accumulates because it's got a lot of waste products. So there's a metabolic activity to these abnormal cells, and they just kind of keep clumping and kind of growing on those waste products. One of the beautiful things about ozone therapy is that the waste products also get removed and eliminated out of that area, and then they get caught up in systems to eliminate them throughout the body. And that's very beneficial to reducing tumor size and tumor growth. And we use ozone in our cancer therapeutics on a regular basis. So our cancer care program definitely uses ozone. We use it a lot for supportive therapy, but we're delighted to see that people are discussing it, including Dr. Velio Bocci is discussing it related to modulating the immune system and preventing cancer progression and supporting recovery post-treatment. So we want to realize that ozone therapy is also known for its anti-inflammatory and antimicrobial properties, which is very beneficial in reducing cancer-related complications, because there's arguments that obviously cancer is very pro-inflammatory. I think that's very fair. And two, that there can be microbial impetus, or there can be a argument that cancer comes from chronic infection in some individuals. And I absolutely believe that to be true based on our clinical experience here. Ozone therapy is often labeled as alternative. And a lot of people think that implies it lacks sufficient research. Again, my argument is that there are going to be small studies for this. There is something in research called qualitative, which really looks at the way that you can, it's often considered anecdotal, which I think is unfair, because if it works for someone, it's likely going to work for someone else. Now, definitely you want to look at quantitative metrics as well, but there is something to think about quality research? What's the qualitative or kind of one-to-one situation for people? Anyway, there's definitely growing evidence in using ozone in integrative cancer care. So it's really integral to see it as a complementary treatment rather than as a replacement for traditional therapies like surgery, chemo, and radiation. I'll leave it at that. But we are seeing that patients increasingly combine ozone therapy with conventional treatments of surgery, chemotherapy, and radiation to manage side effects, improve energy levels, and enhance immune system function. We had a patient, and I just want to say, imagine that you had survived cancer, right, and then developed liver failure. So imagine being told that you're on the transplant list, you can't see your grandkids for months once you have the transplant, and that just the quality of life in that is very sad, and you don't really want to do that. We had a patient like that. He was on the liver transplant list and was expected to be receiving a liver transplant in the next several months. And that's why there were conversations about what it would mean to be on immune suppressant medications. That would mean that he would be in complete social isolation for, I think it's 6 months or more. He decided to use ozone, and he did 10 sessions of ozone. And he was removed from the transplant list at a major medical university in the United States. And this is now maybe 4 years ago that this happened, 5 years even that this happened, and it is a remarkable story about the ozone therapy and rejuvenating tissue. Now I want to go into antioxidants and ozone and how to have a balancing effect. So one fascinating aspect of ozone therapy is that it does induce controlled oxidative stress. It also encourages the body to produce its own antioxidants. So when combined with an antioxidant-rich diet of fruits and vegetables, supplements that have that, and then infusions or injections like high-dose vitamin C, methylated B12, folate, we often call that infusion a Myers cocktail. There are therapies that combine a balance between oxidative stress and antioxidant protection. This allows the body to combat cancer care more effectively and also protect healthy cells. Or as I sometimes say, you're killing the cancer and not killing the host. So that's important. There is not an ozone therapy that contradicts the benefits of antioxidants. So ozone therapy does not contradict the benefits of antioxidants. It might seem like it at first. However, when you have a controlled acute oxidative stress, ozone stimulates the body's antioxidant defense mechanisms. Again, it kind of gives the body a little bit of an injury, and then the body says, okay, or it gives it a little bit of an impetus, and the body says, oh, I better kick into gear, and this makes the body stronger. This synergy is key to both preventing cancer and enhancing recovery. Before we go on, I would like to share how vitamin C works in the body, because I think it's just a really important way to understand the body and also its relationship to abnormal cell replication in the body. High-dose vitamin C, first of all, you can get 5, 15, 20, 25, 30,000 milligrams of vitamin C via IV going into your body within 25 minutes to go in and get into that circulation and get that penetration through the body. And this is what happens. First, vitamin C acts like a sugar. And cancer cells love sugar. So when the cancer cells, and also infectious cells, when cancer cells see the sugar-like properties of vitamin C, it will gobble them up. And then what happens? Well, then vitamin C converts into hydrogen peroxide, and it explodes the cancer cells. And that H2O2 is already seen regularly in our bodies in something that is lysozymes, or part of the actual natural cell death promotion that happens in our bodies when we have tissue renewal and regeneration. Vitamin C comes in as a sugar, like Helen of Troy. It hides itself. then the cancer cells are like, yay, I love sugar. And so the cancer cells eat the vitamin C, and then the vitamin C converts to H2O2 or hydrogen peroxide, which is a lysozyme or a killing agent. And then it destroys those cells that have eaten it. It's a huge win, because we can see now how a powerful antioxidant like vitamin C actually converts and creates an oxidative stress, but it does that in abnormal cells like cancer cells, and then that deteriorates those cancer cells. It's fantastic. And the same thing is similar when you think about ozone, because it's coming in kind of hot. It's coming into those tissues, and it's like, okay, I'm out to destroy those tissues. But what it does with healthy cells is ozone actually improves oxygenation. And then what it does with cancer cells is it disrupts them by creating an oxidative stress that they can't handle, which is fantastic. So we look at combining antioxidants like curcumin and turmeric and quercetin and frankincense does a great job, actually. It's a cytotoxic agent for cancer. There's many more. Alpha lipoic acid is incredibly impressive as an antioxidant and as a cytotoxic component for cancer therapeutics. And over time, the combination of antioxidants and ozone therapy offers several long-term benefits for cancer prevention and treatment. Again, I wish for everything that this is about cancer prevention for you. But if it's about cancer treatment and looking at options, it's important to realize how valuable plant-based eating is and how valuable ozone therapy is to improving immune function as the immune system becomes better equipped to detect and destroy cancer cells. By enhancing tissue oxygenation, cancer cells thrive in low oxygen environments, but ozone therapy improves oxygen delivery, making it harder for cancer to spread. Reduced inflammation. Chronic inflammation can lead to cancer, and both ozone and antioxidants help reduce this risk. Protection of healthy cells. While oxidative stress can damage cells, antioxidants protect healthy cells, ensuring your body remains resilient throughout treatment of agents that create high chronic oxidative stress. Using ozone is an acute oxidative stress that builds our body's antioxidant therapies. I want to share another really great patient story as we wrap up. So you might be aware or not that ozone is available in IV injection. That's very powerful. It can be put into oils, so it can be sustained in oils. It can be wrapped around and bagged for appendages, which is amazing. Can also be used vaginally, rectally, in the bladder, which is impressive for those therapeutics. Also, home ozone machine is something that several of our cancer patients have, as well as several of our other patients who are looking at prevention. And a home ozone machine is basically an ozone generator. It takes medical grade oxygen from a tank. There's a tube that connects that to an ozone generator, and then there's an outlet that allows for a syringe or some tubing to take that oxygen into a temporary housing element like a syringe or a bag, and then it allows for the body to have these therapeutics on a daily basis. We have a patient who 5 years ago was diagnosed with ovarian and a dual primary with breast cancer with Mets to the spinal column. This patient is a remarkable woman, living in her late 70s, alone in her home. She's busy as all get out, and I think her social calendar is more than mine for sure, with all the activities that she does. She uses the home ozone very frequently, and she can feel the home ozone therapy penetrating into the abdominal cavity from an external use. And I think that's very important because you know the consequences of a patient who has ovarian cancer, and one of those concerns is abdominal implants. right? So that this patient can actually feel the ozone penetrating into the abdominal cavity and giving that kind of oxygenation and prevention has led her to have a remarkable quality of life. And she is, like I said, in her late 70s. Anyone would find her life to be remarkable. And she's had breast cancer, ovarian cancer with Mets of the bone for 5 years. So she is doing fantastic. She does use Ozone IV, but like I said, this story is also about her home ozone machine. So, as we discussed today, antioxidants and ozone therapy both play an essential role in preventing and treating cancer. They work in harmony, strengthening the body's defenses and enhancing the effectiveness of your body's inherent ability to heal. Some people will use them together with traditional treatments of surgery and or chemotherapy and or radiation. And we definitely support working together as a team. I love to be part of your team, working with cancer prevention or treatment, and really support in a non-judgmental, love-based way to promote medicine and healing for you with what you need. Whether you're focused on preventing cancer or looking for ways to support your recovery, these therapies offer a powerful complementary approach to achieving better health outcomes and living your best life. Thank you for tuning in to Feel Better, Feel Great. If you're interested in learning more about these therapies or how they can fit into your cancer care plan, feel free to reach out on our website, drmcswain.com. Or I also have a course called Holistic Cancer Care Overview, and this is a beginner course to help you understand cancer diagnosis and treatment. This course is really as objective as I could possibly be, just to give you information about overall cancer care, and then also what holistic cancer care can be, either supplemental or primary to your own personal decisions on how to address cancer. So that's what I hope you obtain if you do see that cancer course, cancer care overview. Please join me next week for more tips on feeling your best every day. Thank you very much.